Hi everyone, hope you're well. Welcome along to Spill the Beans. My name is Duncan Goldie. My guest this week is Dr. Anas Nader, who is the CEO of Patchwork Health. After training as a clinician in Toronto in Canada, Anas was able to come over to the UK and joined the Imperial College London, where he did his Bachelor's of Medicine. So he basically stayed in the UK since then. So he's accomplished quite a lot in a relatively short period of time in sort of clinical innovation and improvement, and it's a really interesting story about where Patchwork came from with the partnership of working alongside an NHS trust. A lot of these innovations that we hear of really are born out of people's own personal experience within healthcare, or recognizing it as a solution and then trying to implement that externally to the public health system that they're supporting. But this is actually collaboratively developed with a NHS Foundation trust. So really interesting insight into how they've been able to scale from there. So I hope you guys enjoy it and take it away.
Cool, Anas, thank you so much for taking the time to feature on the podcast with me today. It's nice to see you. Tell me, whereabouts in the world are you right now? Where are you located?
Thank you, Duncan. I'm actually in London.
Nice to speak to a fellow Londoner.
Yeah, and it's been interesting times being in London recently.
Yeah, how's the working from home situation or lockdown life for you at the moment?
It's wearing on me now. I think our business has always been semi-remote anyways. So it wasn't as dramatic of a change in the early days. Most people had at least half of their week, if not more, working from home, and the other half coming to the office as and when they need to be in the office. So we were already kind of prepared to be distributed, but after the first few months, it just got a little bit exhausting. Zoom fatigue. I think people get a lot of energy from being around each other, all these kind of side conversations, hallway conversations. We miss them all. So we were very pleased when we were allowed to come back partially to the office again. And we have been going back to the office. So Wednesdays tend to be my office day. Yesterday I was in the office, and different teams in the company pick their days. So definitely a welcomed relief from the complete isolation we saw earlier in the year.
Yeah, definitely. It's some kind of normality. Long may it last, but we'll see. Touching wood. Great. So obviously, you've co-founded and you're heading up Patchwork, which we'll go into in a lot more detail in just a second. But tell me the story about you. What's the kind of start of your career, and what led you up to found Patchwork?
So that kind of takes me back to over 18 years ago now. Back to my first degree at the University of Toronto, where I grew up. And back in Canada, I did my first degree in human physiology and political science. And it was meant to be a generalist degree, a bachelor degree, in preparation for whatever I do next. And in North America, unlike most of Europe, medicine is done as a second degree. So you do a pre-med, and that could be your choice, of course, and then apply to med school. So I did that with the intention of potentially exploring med school down the line. I wasn't ready to commit to that career choice yet. So after graduation, I went to work as a research assistant at Sick Children's Hospital, as well as picked up on some side projects with St. Michael's Hospital to do to build software and tech for healthcare. Now, I was a self-taught coder. I was an amateur. I was definitely trying to dabble with technology in the early to mid 2000s, but I really got into it, and that led me to one of my mentors recommended me to do a master's at the same university that I did my first degree, and it was a master's that helped me professionalize my work in digital health. Primarily, I was working on creating online content for students, educators in healthcare, as well as patient education. So I did that, and I graduated from my master's and continued to work in Toronto in different hospitals, working with different projects, a little bit as a freelancer and sometimes with agencies. And that exposed me to a lot of clinicians, a lot of patients. I did a lot of work in hospital environments, and that bug in me that always thought, was always really considering medicine as a career was still there. So I've decided that actually I'm going to apply to med school and still pursue clinical work. So I was in my mid to late 20s at that point. But I also wanted to change. I wasn't going, as much as I loved my alma mater, University of Toronto, I wanted to move. And I applied and got a scholarship to study at Imperial College in London. So that was my move to London about now 11 and a half years ago. And in London, at that point, the UK started introducing a very similar programs as North American schools, the accelerated medical school programs for students like me who had a degree before then. So I did the 4-year program at Imperial College, and that's actually where I met my co-founder, who was my colleague at Imperial College. And anyways, I graduated from med school, and I can, before I continue to say my career in the NHS, as you probably would notice by now, I have had a very unorthodox journey to becoming a doctor. It had multiple other previous lives and careers that have always made me think I'm the odd one, that I am a little bit the weirdo in the group. Luckily, I've discovered as soon as I graduated from med school and I started working as a doctor, that in the past couple of decades, the world of healthcare has evolved and has changed. And that typical scenario of a 10-year-old kid who wants to become a doctor actually becomes a doctor straight from university, straight into healthcare, straight into being a doctor or a nurse, all the way until retirement. And that's their defining, the defining aspects of their career is now actually the rarity. Most doctors, nurses, pharmacists have unorthodox routes into their careers nowadays. And most of them, after graduating and becoming qualified doctors, nurses, pharmacists, allied healthcare professionals, really any healthcare professional, end up having a more diverse and portfolio career, or at least many of them want to. So some had better success than others, or some do have better success than others, but every single other doctor or nurse or other healthcare professional I have worked with since graduating from med school and working as a doctor in the NHS have expressed similar desires to seek a very different profession, or a very rich professional life, but very similar frustrations. So I then became a doctor, worked for a few years in the NHS, met quite a lot of other quote unquote weirdos like me who didn't just want to become doctors as much as they loved being doctors. And that kind of led me to do a few other projects as a doctor that eventually led me to Patchwork.
Fantastic. I mean, yeah, like you say, it's nice not to be the odd one out, or it's nice for the odd one outs to be the norm as well, because it makes my life on a podcast a bit more interesting, at least. But talk to me about the work that you were doing within the NHS, right before. What were the kind of issues that you were seeing that you thought, I need to form something here, I need to become a bit more of an entrepreneur to form Patchwork as the solution?
Yeah. So I started my career in the NHS as a junior doctor. I was training to become an A&E doctor. And A&E emergency medicine was my interest. I love the drama of the emergency room. I love the generalism, where you're seeing very different kind of pathologies, not just one specific area you're specialist in. However, it did present with its own challenges, and it's not unique to emergency medicine. I think most medical specialties, as well as non-medical specialties, have the same challenges, and that is very gruesome working hours with very rigid models of employment. So I was at a phase of my life where I still loved coding, and I was still kind of dabbling with projects on my own. I did some work with some global health organizations like MSF and others, because that was actually something I started in University of Toronto, where I was quite involved in international health projects and field projects. And I wanted to continue to do some of that. And I had to use all my annual leave while I was in the NHS to do a few weeks here and there in different projects overseas. And I've met with many other doctors like me who equally wanted to remain active clinicians, did not want to hang the stethoscope, but at the same time had interests in sports, music, entrepreneurship, consultancy. Some of them wanted to become management consultants. Others were interested in property investment. Some wanted to travel the world. Some wanted to do humanitarian work. Some of them just want to spend more time with their kids, their young parents, or look after their elderly parents if they have parents who need some care. And universally, every single one of them had the challenge of trying to remain an active clinician in healthcare whilst pursuing all their other professional or personal interests. And the system was very hard to navigate for part-timers or complete day raters or flexible workers. So I recognize that challenge that I faced and many of my colleagues faced. And there was a summer of 2016 where I met with my co-founder now, Jing, at a tech conference in London. After med school, he went on to back to his hometown, Liverpool, to work as a doctor there. And I stayed in London. So we stayed in touch, but we met that summer and we both of us kind of were ready to take a year out of the NHS, to take a break, to pursue our interests. Because he was like me, one of those not so rare anymore weirdos. And in that conversation, we talked about, wouldn't it be nice if it's much easier for us, doctors like us who are keen on remaining active clinically but do other projects or other work, to be able to book shifts as and when we want them, to be able to have a little bit more control over our way of working rather than being given very limited options. And we thought about it and we thought, can technology solve that? And we obviously have seen other industries utilize similar technology to solve similar problems, but we probably felt that we were naive. It's very hard to address that world. Building tech in healthcare is hard as it is. When healthcare is primarily public sector, like in the NHS, it's even harder. So we kind of shelved the idea, but then I decided to take a different route. I took a year out of my clinical work to join Chelsea and Westminster Hospital, an NHS trust, to join their innovation team and transformation team to do a clinical innovation fellowship. And that's where I got lucky, because it was an innovation fellowship that wanted doctors and nurses and other professionals to be healthcare professionals to be part of the management team to solve different problems. There could be efficiency problems, cost problems, patient care, quality problems, just solve problems and improve the services. And I was assigned to a few projects, and one of them happened to be looking at how the hospital can reduce its reliance on agencies and locum agencies, and be better at managing the flexible workforce. And that's, to me, where I connected the dots, because I've always thought of the problem of flexible working from a clinician's point of view. Because of course, I didn't know any better. I'm a doctor, and everyone I was around was a clinician like me. But that experience has led me to really look under the hood to understand the challenges from the employer's point of view. And of course, I realized that it was quite naive of me to think that it's simply, can we just build an app for it, right? It is not as simple as building an app for it, because it's, from the employer's point of view, from the NHS trust point of view, the challenge was a lot more complex than that. It's about managing large volumes, and I'm talking about thousands of shifts, tens of thousands of hours a month of vacancies that require flexible workers to book them, whilst also ensuring compliance and efficiency and adequate communication and safe working hours and everything around that. So it was a lot more complex than any of us have expected, or at least I have expected. But again, that's why I was really grateful for that experience, because it allowed me to spend time with the trust to understand all aspects of the problem for different stakeholders, map it all out before we even wrote the first line of code. Now, obviously, as a doctor who is being seconded from his clinical work to do non-clinical work, that was a very interesting experience, because it got me to work with the executive leadership in the trust, as well as managers, to solve the problem from a purely managerial and efficiency point of view and transformation point of view. I then obviously revived the idea of, let's see if technology can solve this. But this time, I'm no longer looking at it from the clinician's point of view only, but from the clinician and the employer's point of view. And I went to my bosses, the chief executive officer, the CEO, the COO, and the HR director of Chelsea and Westminster Hospital, and I proposed to them to collaborate together to build something co-designed with the NHS, with that hospital and its stakeholders, as well as myself, my co-founder, and bring something to market and pilot it at Chelsea first before taking it elsewhere, to solve that challenging problem of recruiting and retaining hundreds, if not thousands, of flexible workers, to plug in thousands of shifts, to ensure safe staffing levels, whilst ensuring compliant workers and being the employer of choice for flexible workers. So obviously it wasn't as easy as that. It took us about 6 to 7 months to come up with the MVP of MVPs. We launched that in July of 2017. And even though it was far from perfect, and it took us many more months and possibly years before we got to where we are today, a much more refined product. But even back then, because the scale of the problem was so big, we managed to get quite quickly at, we managed to get quite good at delivering impactful change, that within 3 months of going live, we increased the hospital's bank fill rate to 90% and achieved roughly £1 million in annualized savings. So it just felt like there's so much low-hanging fruit in the system that even the early MVP managed to deliver some remarkable impact. So that got me on that journey, and it's been 3.5 years now, but quite an interesting and quite an interesting roller coaster, but also very, very rewarding to date.
Yeah, definitely. And it's there's a few kind of issues within the NHS, to say it lightly, that there's lots of products out there to solve, but to be able to do it collaboratively alongside somewhere which is kind of commissioning you already as a pilot before you've even built the product. How do you feel that? I mean, obviously that benefits you from a kind of maybe there's less risk involved to be able to sort of get it out there and see and kind of iterate, in a live kind of way, rather than having to sort of build something and then show the value before getting your first client, as it were. So how do you feel that kind of helped shape the product kind of for the NHS?
So I can answer that question from two sides. I'll answer it from the NHS's side, and I'll answer it from the entrepreneur side, from my experience and why that was helpful for me. So from the NHS's side, I think it was an absolutely defining aspect of our company and our entire journey, because it meant we were born out of a partnership from day one. And it also meant that every single, in the company's own DNA, is partnering with the end user. And it's not just a marketing statement. It just genuinely means that every single feature we've built back then until to date has been co-designed by the stakeholders, our customers, the NHS. And that's not to say they're doing the work for us. We are the innovators. We're the ones who are meant to find the solution for their problems. But by working with them as true partners, it meant that we have embedded ourselves into their world and understood the problem in its full extent, so that it de-risks it from their side when we build something to solve that problem, and de-risks it from our side that we're not investing so much time and effort building the wrong thing. It also meant for them that probably quite rarely does the NHS or healthcare in general receive tech that was designed with them in mind. Often it tends to be parachuted in externally for better or worse, it's not because other technologists didn't care to partner with the NHS. It's just because it's really hard to work in collaboration with large healthcare institutions if you do not know how they think and how they function, and you aren't able to embed yourself into their culture and be part of the organization itself. So I think it is not easy to do, but when it's done right, it's remarkably impactful, because it meant that we are not just thinking about the problem superficially, but we've gone down so deep into the problem that we've thought about every single detail and nuance. Often when we present our product to new NHS trust as we go around the country implementing our solution, the continuous feedback we get from people is, you really genuinely have thought of everything. It's never always perfect. We're always iterating, we're always improving, but our solutions often get packed with so much nuance, because healthcare is complex. Healthcare is, and healthcare solutions cover large surface areas. So technology in healthcare is never as simple as a single point of value delivered by a really simple product that does one thing right. It's the kind of solution that needs to do 100 things and need to do them all really right. And I think that makes it that much more important to invest time in building partnerships with your end users, with your customers, so that you shorten that feedback cycle, shorten that innovation cycle, make sure you capture all the risks early on and mitigate against them. And from an entrepreneur's point of view, it meant that I felt more confident to take that leap, more confident to feel that, you know, I can go and raise investment from the VC world with the confidence that I understand the problem from both sides of the market, the employer and the worker, and I have a good visibility of the solution, that I can visualize myself building it because of that experience. So it really built my confidence and my co-founder's confidence to seek that investment and to build a team around ourselves and deliver on the solution. And it also meant that it's a lot more satisfying, because most entrepreneurs were never born as salespeople. And in fact, I think if you ask most entrepreneurs, the hardest things they had to learn to do as entrepreneurs is sell, because entrepreneurs tend to be either technologists or professionals in their space, and they're trying to solve a problem in their world. In my case, I happen to be a doctor who's trying to solve a problem in healthcare. The nice thing about building a strong culture of partnership within the entire company, starting from the founders and all the way down to everyone else, means that it makes it a lot easier to engage with your market, because you're no longer just trying to sell a product. You're actually trying to solve a problem as a partner, and it just makes it a lot more rewarding and more fun to do.
Yeah, exactly. I mean, how are you finding the feedback coming through from other trusts that, you know, haven't been there from the inception, and you're kind of rolling out? You are, in essence, to use your phrase, parachuting in a solution. So you're seeing it from both sides. What's the feedback from them?
So luckily, so again, I think we, every single one of our NHS partners has viewed us in the same lens as Chelsea and Westminster Hospital has viewed us, because one of the things we have invested in very early on is our operational team. And actually, often if you look at our org chart today, we have more implementation and customer success people in the business, or at least as much as we have as technologists, and technologists being engineers, designers, product managers. We actually have as many of them as operational teams, as if not more. And the reason is because we also recognize early on that that implementing technology solutions in healthcare is about good change management. Because again, the products in healthcare, or the technology products introduced to healthcare, are never a single point of value. They tend to be products that cover a large surface area, an entire domain. So that could be clinical records, or it could be diagnostics, in our case, HR function, and like flexible working. And therefore, you're not working with one or two stakeholders. You're probably, outside of just the doctors or nurses that are using the system, even from the employer side, every single new trust that joins Patchwork, we're engaging with hundreds of users. These are payroll managers, HR managers, recruitment teams, compliance teams, individual departments like A&E, pediatrics, obstetrics, and gynecology. Each one of them have their own administrators who have to manage vacancies and shifts. If we combine that in an organization that has anywhere between 5,000 to 10,000 employees, we engage with at least a few hundred of them. That's a strong change. That needs a strong change management program, because you're going ahead to change the ways of people's working for hundreds and to do so for hundreds of people. And because we recognize that from day one, we've really invested in our operational teams. So when we come into an NHS trust, they see our implementation team and customer success team from day one engaging with all the right stakeholders, building those links, understanding their problems, and then configuring the solution for their needs. Because we also appreciated, whilst the NHS feels like a single institution, it's actually a franchise. Every single hospital uses the NHS logo, but they've got their own differentiators, their own culture, their own particular needs. And certainly when you move across the country, across regions, the North versus South versus Wales, it's always going to be different. So we also made sure that whilst we have a single product and it's not customizable, it's configurable, it's highly modular. So our implementation team in the early days would spend quite a lot of time with the hospital stakeholders to capture their requirements, their preferences, their configurations, their rules, so we can configure the system to their requirements. So it feels very bespoke, even though it's actually the same tech. And then they all have the same feeling that Chelsea had, which is this is not a company coming to parachute a solution built with that one other hospital. It feels my solution because I get to configure it and I get to spend time with the Patchwork Health team and they spend time with me to understand my unique problems, my unique challenges, and support me in that journey to get to the outcome, where technology is merely an enabler. Because at the end of the day, if we try and sell licenses or solutions for technology that no one uses, then we will not have repeat business. Then we will not have the market share that we want to have, or the real long and lifetime value that we're trying to generate with every NHS trust. So it really starts from that very early days implementation period, and therefore our experience from whether it's the very first trust or the 17th trust now has always been very similar in how we implement.
Perfect. Well, look, I mean, we're almost out of time, which is incredible. It absolutely flies past sometimes, and there's obviously a lot more that we could talk about.
I should have warned you that you should interrupt me.
No.
I could go on sometimes about some of these, but I'm yeah.
No, it's great, and it's really, really interesting as well. But I mean, if anyone's sort of listening and they want to, hear more and they want to find out a little bit more, what's the kind of best way for them to do that?
Well, our website is patchwork.health. Our Twitter handle is @HeyPatchworkHealth. And yeah, they can drop me a line at anas@patchwork.health. So I'm more than happy to engage on any topic about our business. And we're in a very exciting phase, primarily because in the past 8 months, 2020 has been a year for us where it has renewed our mission, and if anything has strengthened our mission to deliver flexible working for workers who are looking for opportunities, as well as for employers to be able to deploy contingent workforce at pace. So we're energized, we're really excited by the work we're doing across the NHS for COVID and beyond. So yeah, I'm more than happy to talk to anyone who's listening about anything that interests them about Patchwork.
Definitely. Perfect. Well, I'll put all the links to that in the summary of the podcast as well, so people can get in contact. But Anas, thank you so much for taking the time to chat with me. It's been really, really interesting, and I'll let you crack on with the busy work that you're doing.
Thank you. It's been a pleasure. Thank you very much.
Speak soon. Cheers.
Take care.
So that's it for us this week then, guys. Thanks very much to Anas for taking the time to chat with me on the podcast. Really interesting to hear from him and his insights into providing, a system flow solution and staffing solution to the healthcare industry, which is quite a big issue, really, and sort of breaking through the barriers of not just providing a new innovation in terms of a technology, but trying to implement and change an entire process isn't something that's easy to do, but is very much needed if we're going to drag the public health system in the UK kicking and screaming into the 21st century. So if you are interested in any of the work that they're doing, then by all means click on the links in the summary of the podcast and you can find out a little bit more information. But until then, keep safe, keep sane, keep well, and we'll see you guys next week. Cheers. Have a good one, guys.
Spilling the Beans Digital Health Podcast is aimed at members of the digital health community globally, with guests from the United Kingdom, Australia and the United States. The podcast is available through all major podcast distributors as well as on YouTube. The show is sponsored by Woodrow Mercer Technology and Woodrow Mercer Digital Health.